Hi, my name is Jennifer Hoffman, and I am the Digital Navigator Program Coordinator here at Somerset County Library. And so today I am going to be teaching you about getting started with telehealth. So what I'm going to talk about is what is telehealth. Also about, we're going to follow about using the patient portal. Also, what you can do with that patient portal, creating your account, using the messaging feature, and some other helpful settings. And then I'm going to go over the technical requirements. So I'm going to talk to you about which device is going to be the best for you, and also some tips for troubleshooting some common technical problems. And then finally, I'm going to talk about attending the appointment. So what to expect the day of the appointment and after the appointment. So what is telehealth? Telehealth is actually a way that you can see your healthcare provider using a computer, tablet, or phone without visiting their office. So think about it like you are like an actual like in-person doctor's visit, but it's actually like just over the phone. That is what telehealth is. And of course, telehealth also does manage different aspects of your healthcare online. So that's what telehealth is. And a provider is actually somebody who or organization that actually has the medical care team. So that's what the healthcare provider is. So I'm just going to move on to then, there are many different types of people who provide telehealth services. So that includes your doctors, your nurses, your pharmacists, your mental health care professionals, and physical and occupational therapists. And then we also have your medical offices too, and your clinics, your hospitals, and your home health agencies. So these are all different types of healthcare providers that are out there. And then we have different types of telehealth care. So we have that you can actually schedule appointments, you can check in on your medical issues, you can discuss different lab tests or x-ray results, you can also follow up on prescription medications, you can also receive post-surgical follow-up, and also receive your preventative care like nutrition counseling. You can also receive referrals to specialists, and you can also receive mental health treatment. So all of those are different types of different telehealth care. But the one reason that people use telehealth is just because it's just very convenient. Telehealth allows you to receive care wherever you're at, so like at work or at home or in your car, and you don't need to travel to and from your appointment. And it's just easy to see your doctors that are far away. So I'd like to give this example. So locally, going to Pittsburgh is an almost 2-hour drive from here. So for that, you don't even need to have to travel to your Pittsburgh doctor. You can just do that via telehealth. So I really think like doing that makes it convenient. But there may be some benefits as to having an actual in-person visit. So some of the reasons are your provider may want a face-to-face visit. So if you like just started a new doctor, they're going to request you to have that first face-to-face visit. A second one is your provider may need to conduct some type of physical examination. So if you have like a rash or anything like that, they need to see that. Also, your provider may need to use different type of specialty equipment. So, for example, if you need to get an x-ray done or any type of imaging like EKG and the rest of the different other specialty stuff, you have to do that in person. And also, and again, this is very important, your insurance may not cover your telehealth appointment, but may cover an in-person visit. And so that's why I suggest that you actually call your insurance company and find out if they do cover your telehealth appointment or not. So there are 4 different types of telehealth care. So there are video visits, audio only visits, secure messaging, and remote monitoring. So I'm going to go through all of that. So video visits, basically video visits is like having a Zoom meeting. You are watching a video screen with your provider on the other side. They see you, you see them. So that's what the video visits is. Then we have audio only visits. Again, that's just you calling them over the phone. Secure messaging, it's actually a way for the patient and provider to send messages back and forth online privately and securely about the patient's medical care. So it's like sending an email, but you have to use the portal to make sure that only you and your healthcare providers have access to this communication. So, so you can like ask your provider different types of questions, and they can email you back. So that's what secure messaging is. And then we have remote monitoring. So that is when they might want to monitor certain health conditions over time. They might use some type of medical device with an internet connection to share information with your doctor. So like your blood pressure, glucose levels, monitoring your sugar levels, things like that. So that's what remote monitoring is. And so how can we find your healthcare provider who supports telehealth? Again, just ask your current provider if what telehealth options they offer. Also, and again, like I said before, you want to make sure you contact your health insurance company to see if they have a list of providers who offer telehealth services. Again, it's just important. You want to make sure that your insurance does cover this. And then, of course, you could do some other online searching to see if there's other options out there. So I'm going to move on here to what is the patient portal. So the patient portal is actually a secure website provided by a healthcare provider, a hospital, or a clinic to manage your medical care. It's a way that you can access your information just by using, you just need a browser or an app. And again, it's just a way for you to contact with the doctor. Also, you can see your own medical records too, is what is on the patient portal. So moving on here is things you can, so there's a lot of things you can do with a patient portal. You can actually read your provider's notes about your medical visits. You can also view a list of your medications and request refills. I really like this one. So you don't really necessarily always have to call your doctor saying, hey, I'm out of pills, I need a request for a refill. You don't need to do that. You can do this online through the patient portal. Also, you can see a history of your medical care. So if you are like visiting, if you have been a patient at your doctor for a while, you can go back from the beginning or just whenever you started seeing them and look through your history. Also, you can also track which appointments you need to schedule and which ones you have already scheduled. So you can easily do that too. And you can actually schedule your appointments. So again, you don't necessarily have to call. And you can pay and view your bills too. And also you can see your lab and other imaging results too. So there is just a lot that you can do with the patient portal. So before we, to create a patient portal account, you're going to need a computer, a laptop, tablet, or smartphone, any of those devices. Also, you need to have internet access and a web browser. So to find your provider's portal online, you must first go to your healthcare provider's patient portal. So to do that, you're going to have to open a web browser. And again, these are what web browsers are. So we have Google Chrome, Microsoft Edge, Apple Safari, Firefox, whichever option you like to use. And then you're going to search for your provider's patient portal. But in this example, we're going to look for what is called Heartland Health Skills Patient Portal. And if you can see there, that looks like a legitimate patient portal. So that's probably the official one. So we click that, and then it takes you to the screen. Your patient portal, of course, may look different than this, but you should be able to apply what I'm going to teach you today to when you can use your healthcare provider's patient portal. So all of this will be beneficial to you. So on this, we click sign up now. Once you click sign up now, it takes you to this screen. And this screen says enter activation code. So this basically what the activation code is. You have to ask your provider to send you, they're going to ask for this code in advance, either by email or in the mail. And each portal is different, so you're going to follow whatever the instructions display on the screen. So in this case, you need an activation code, and that is something that your provider is going to give you. Depending on that, I know, like for my particular doctor, when I got into one of the patient portal, I asked them actually at my in-person appointment, and they actually gave me the code right then and there. So I wasn't sent anything online. Some providers may do that for you too, so you don't have to come in to do that. Also, just of note too, with activation code, you have to probably do this in a brief period of time in order to activate it, or your activation code may expire, and then you're going to have to ask them to do it all over again. So it might be very timely. So I would say ask them about, like, how long do I have to do this with the activation code before that expires, and you're going to have to get another one. So you would put that activation code in, then you would put in your date of birth, and then you would click next. So once you click next, it takes you to this screen, which is, again, going to ask you to create a username and a password. Just like with any other online websites, to create one, you go through this process. Again, you want to make sure you know what your username and password is. So again, pick something that you're going to remember. Also, possibly write this down somewhere if you do that, or have it saved somewhere so that you know what this is. So again, you're going to put your username in, put your password, re-enter your password, and then you're going to click OK. Now down here, there is an option that's saying link to existing account. And what this means is if you are a person who has children, or is in charge of minors, or also someone who's taking care of an older adult, you can actually link your account to them. I'm not sure about locally with our providers in the area, so I'm not sure if they have that option too, but this one does. So I would say definitely ask your provider if that's an option, so that you can actually be able to look into their account as well, and not just yours, if you need that option. And then we hit OK. So after that, we have this web page appears saying to agree to the terms of use. Again, it explains how the healthcare system can use your information in the portal, and you just have to agree. So you click I agree. And then there you go. Your account has created, and information will appear on the screen. So again, remember that each patient portal is slightly different. So again, follow the instructions that display on the screen as you create your account, and on your provider's patient portal. And also two notes. One is if you have multiple doctors through different healthcare systems, you're going to have to create patient portals for each of them. Also, another thing of thought, food for thought here, is if you do have any other questions or experience any problems with your patient portal, you want to call your provider and have them walk through and have you to talk to somebody who can help troubleshoot some of these things. So let's keep that in mind. Also, if you choose your tablet or smartphone to create an account, there's actually two ways you can do that to access your account. One is through an app. Some patient portals do have an app that you can just download to your tablet or smartphone, and you can access it just through the app directly. I know personally I don't do that. I normally do this through a desktop or a laptop. So, but if you like that option, you have that. Or you find whatever the browser is, and that's where, and again, just use it through the browser. So next, while you still can actually call your healthcare provider on the phone, you can also send messages using the patient portal. So when you do send information to your provider, it's recommended that you use your patient portal instead of using your personal email or sending a text message. So, and when you send a message through the portal, someone from your medical team will actually respond back to you. So they will do that. So in order for us to send a message through the patient portal, and again, this portal looks different than what your current ones may or may not look like, but you can again use this information to be able to use your own patient portal. So for this, we would click message, and then this screen's up. So again, this actually has a little menu option asking what would you like to do. So it asks to schedule an appointment, to refill medication, or ask a care team a medical question. So you would select which option is the best one. And then it asks you who do you want to contact? And if you do have more than one provider, you will need to select which healthcare provider you would like to send the message to. And then after you would click that, it gets to like an email message where you put in your subject, put in your message, and then click send. And then a healthcare provider will respond. Sometimes they're going to send you a message back through the portal, or they might give you a phone call. Again, in this example, looks like the nurse responds using the portal's messaging system and asks for additional information. And again, you can use the portal how you want to respond to these questions. So again, don't forget your patient portal can be accessed using any computing device that has a web browser and internet access. You can also send a message using your computer or laptop, but you can respond the message using your tablet or phone, or vice versa. And again, you have different ways that you can access to be sending these messages to on your smartphone or tablet, either again through your internet browser or through the app. So moving on here we're going to explore what your technical requirements are for a video telehealth visit. So to connect to a video telehealth visit, you're going to need to pick a device with a camera, microphone, and speaker. So I'm going to explore what options or devices that you should pick, and we're going to go through some pros and cons and for this. So for a smartphone or tablet, some benefits of this is one, they have a built-in microphone, speaker, and camera. Also, it's very easy to maneuver. So you can easily show the provider something. And one nice thing about them is that it's portable. So again, easy to move around. And there are some disadvantages too. First, you may need to download an app. So basically, if you're going to have your video conference with your doctor, they may ask you to download an app in order to access that conferencing system. Also, smartphone screens are small. I know they're very, again, easy to maneuver and portable, but just remember that too, that they are small screens. And also, you do want to place the device on a stand. So again, whenever you have your appointment, you don't want to be like moving around all the time. You just want to have it sit and have it stand somewhere that you don't have to worry about that. So computer or a laptop though, some advantages is one, the screen is large, so it makes it easy to see the provider and anything they share. Another reason is that most devices include the built-in microphone, speaker, and camera. And also, the laptops are portable. Yes, they're bigger, but they are portable too, and that could be a good option as well. But there are some disadvantages to think about as well. So, for instance, desktop computers are not portable, so can't move them around. And some devices may not include a built-in microphone, speaker, or camera, depending on how old they are. But I will say, if you do need to use your computer or laptop and you do not have any of those options, you can actually get some external headphones that have the speaker and a microphone and maybe like an external camera, and you would easily be able to solve those issues. So next, after we done all that, we're gonna have to check. You have to check your internet connection to make sure it's gonna be strong enough for your appointment. And it's best to actually check this on the device that you're gonna have your appointment, so that you can just troubleshoot any issues you have. And you want to test this your internet wherever you're gonna have the appointment. So again, so you know like what type of internet connections you're going to have. So in order to check your internet connection, we're going to use actually a website called Speed Test, and this actually works on any computing device. So I'm going to walk through that. I'll also tell you this too, another option in order to check your speeds. So first is you want to again use whatever web browser you use, and then you're going to search and type in speedtest.net. So that will take you to this screen. And basically what it's doing, you would hit go, and it's going to test your download speed and your upload speed. And basically to attend a video telehealth appointment, they're saying that you should have a minimum download speed of 1.5 megabytes per second and a minimum upload speed of 12 megabytes per second. If there is more than one device in your location using the internet service at the same time of your appointment, again, you're going to want higher speeds than for that. Also, too, instead of speedtest.net, you can also just Google speed tests, and then there'll be an option that says run speed test. It'll be in blue, and click that, and it will run the same thing. So you have those two options in order to run a speed test. Next, sometimes you're going to need to connect your appointment to sometimes all you'll need is a web browser. So you want to make sure you do have the recommended browser installed on your computer and that it is up to date. So sometimes you might need to download and install an application on your device. And again, your provider should send you all of these instructions ahead of time. And again, you do want to test this software out before your appointment so that you don't run into any other issues. Also, for a video appointment, you will need to use a device that has a camera. So while most devices do have a built-in camera, some do not. And one way to do is to look for a small camera lens. On computers and laptops, the camera is usually located at the top edge of the monitor in the center. And also another way to check is you can actually, in the search bar, search for camera. Or you can click the Windows icon in this, and again search for camera, and that comes up and it'll tell you that it is there or not. So again, it should turn on whenever you click the link, so that's a way to check for the camera. Smartphones are the same way. Look at the device there on the top. Around on the other side of the phone, back outside of the phone, that you can see that there's the cameras. Again, you can also look for the camera app to see if they have your phone has a camera. Apple's the same way too. For most Mac computers do have one too, and again, also for the other Apple products as well. They have a camera app too, so you just need to search for that. And then whatever screen comes up, and it should be on right when you click it on. Also too, like I said, if your computer or laptop does not have a camera, you can actually attach a type of external camera, or ask your healthcare provider if an audio-only appointment is possible. And again, if none of this works, check the manufacturer's website for more information on how to troubleshoot your device's issues. And of course, when possible, you want to make sure your device is on a stable surface so your camera remains in the same position during your appointment. So next, you're going to need a microphone and speaker to talk to your provider and hear the response. Again, many devices have all this, so you really don't need to worry about. And there are some different ways to check. So first here, You can see if the little icons on your keyboard. Also, on the bottom of the right side of the screen here, you can see that that there's the camera, there's the microphone option, and if you see an X, this means that it is not on. So a way to troubleshoot it is to right-click it, and it gives you some options. So you will want to click the open sound settings options. And then this goes into the settings. So this screen comes up, and you can look here in your outputs and your inputs to see if it is your laptop or desktop speaker. Again, most phones have this too. You're on the bottom of the located on the bottom of your device where you actually plug it in to charge it. Again, has a series of little holes, may look like a vent. And again, and there is a volume control too on the side of the phone. And also note, you want to make sure you don't cover your hand on the bottom of where the vent is. They're not going to be able to hear you. And then, of course, you can always attach an external headphones with a built-in microphone to your device if it does not include a microphone or speaker. And also, you may want to use the headphones if you're going to be in more of a public area so that you don't want others to hear what your provider is saying. And also, it might give you some type of clearer audio connection as well. So just keep in mind about all of that. So we went through, talked about all these different computing devices that you do need a camera, microphone, and speaker. And again, you want to make sure you have all this so that you will be able to attend your video telehealth appointment. So next here, we're gonna explore some tips for troubleshooting some technical problems. Again, these are going to be some common ones that you may have with your device when you try to connect to your appointment. So first off is a really simple one. You want to make sure your camera, microphone are actually turned on. So again, you may go through, start attending your appointment and they can't see or hear you. So again, with the slash here, that means that it's not on. But you can just click them and they will turn them on. So again, the slashes mean it's off. If there's no slash, then they're on and they're working. Another thing is, again, if you do experience any problems, you might want to just do a restart on your device. So for example, if you're using a Windows operating system, you want to click the Windows button and you want to click the power button and then you just click restart again, and then it will restart your device. And you can also do this on the phone too. You would just click the power button on the side to get to the menus options, and you can power it off, or you could restart it too. And again, if you run into anything, just check your manufacturer's website for more information of how to restart your particular device. Another thing is you want to make sure your device is fully charged or plug in. So for this, you don't want to actually be going into any type of video conferencing appointment or audio only appointment with your provider and have your device die. You just don't want to do that. So you want to make sure that your devices are fully charged for your appointment. Another thing too is you can also close other applications. So sometimes whenever you do close other applications, you are actually helping save some of the bandwidth so that it's not using a lot of your internet connection when you're on your appointment. So what you do, if this is for the web, for your desktop or laptop, you would just click the X. And then and then for the phone, you do have these options too on your phone. So for Android, you would just click that middle circle here, and it should take you to this type of screen, and then you just swipe, or there is a close all option to close them all out. And again, Apple's the same way too. You would swipe up for the bottom of the screen to see all of them, and then close and tap and swipe them up to close them. Also, keep in mind that when the camera is on, it uses more bandwidth. So if the connection starts to break up, you may need to turn off the camera when it's not needed. And also, you do want to make sure that your software is up to date. So some telehealth appointments only need a web browser, and others may need some type of additional software to connect to the appointment. So again, you want to check your provider to make sure you have the software that you need to attend the appointment. And also, you can, if you can't connect with your visit on the device that you have, again, just try another one device then, and that should work for you. And again, throughout any of this, if you run into any of these issues when you're actually at your appointment, again, talk to your provider to ask for assistance, and they should be able to walk you through some stuff too. If you run into any of this. So moving on, we're finally now, we got all the technology we need, went through some troubleshooting, so now I'm going to talk to you what happens when you attend a telehealth appointment. So first off, you want to schedule the appointment. So first, you want to ask the scheduler if the appointment can be a telehealth visit. 2, you want to just verify that your insurance will cover the telehealth appointment. I would actually do is swap these. I would say check your insurance first before you actually want to schedule the appointment for a telehealth. So again, talk to your insurance first so that you know that it's covered. And then let them know if you do need any type of accommodations. So you would just let them know with that. And accommodations could also include if other people are going to meet with the appointment too, because there might be additional forms that you may have to fill out. So some other information you want to prepare before your appointment. So one thing you want to do is make sure you have a list of your allergies, your current prescriptions, the medical devices you use, your pre-existing conditions, your doctors and recent medical appointments or hospitalizations. And you want to you want your address of your preferred pharmacy too, and you can also make a list of questions. So just try to prepare this like you would for a normal doctor visit, but make sure you have all that ready. Then you do want to do before the appointment is you want to actually log into the patient portal. So you want to make sure you actually remember your username and password so that you don't have any issues with that. And you want to log in. You want to make sure that you check that your information is up to date. And also, you want to check if the healthcare provider has requested any information for the appointment. So, for example, I had an in-person appointment, and I got notified actually through the patient portal that there was a pre-registration I needed to do for that appointment. So I did this through the patient portal. And this probably will happen to you too, that you're going to have to fill out some additional information like you would for the doctors. And then finally, we get to the day of the appointment. So there are several things to do to prepare for this. So the first one is you do want to verify that you have received a link to attend the telehealth visit. 2 is you want to review the instructions about how to access the telehealth appointment. Another thing to do is you want to make sure you wear clothing that easily shows areas of your body a provider may need to see if you do need that. 4, you want to make sure that you have your provider's telephone number in case you experience problems connecting to the appointment. So you want to make sure that you have that on hand. Also, you do want to fill out any paperwork that is required as part of the check-in process. Like I said, this could happen actually days prior or weeks prior to your appointment. Also, you want to treat this like you would as any in-person appointment. So you do want to log in 15 minutes early to resolve any technical issues. Also, just be patient because you may actually be put in a virtual waiting room until the provider is ready to see you. And a pop-up message may appear asking for access to your microphone and camera, and you do want to click yes or allow. And if you do bring another person to your appointment, you may need to fill out a consent form. And so during the appointment, you want to make sure your healthcare provider can see and hear you. You want to also let your healthcare provider know if you have problems seeing or hearing them, because yes, they can have problems, technical issues too. And also you want to make sure you review your list of questions. And of course, you can ask questions if you need help understanding something. And you want to also take notes. And so then at the end of your appointment, the telehealth care provider should actually outline the next steps and maybe add a summary to your appointment, to your medical record. And again, you should be able to see all this in your patient portal. And if you do have any questions after the appointment, any follow-up stuff, you can call them, or you can actually message them through the patient portal to get some answers to. And just so you know, depending on the answers to these things, you may be charged for that. And so that's it. This is what we talked about. We talked about benefits of telehealth, and hopefully you learned some skills about using the patient portal, what that can do and how that can help you. Also, some different devices, how to troubleshoot some different technical issues, and also to prepare for your attend your telehealth appointment. So I just wanted to thank you for listening to this, and I hope this information was helpful, and I hope you have a good rest of the day.